Is now with Amit Thakker, who joins us from Nairobi. He's the chairperson of Africa Healthcare Federation. Really good to have you back with us. We know that a successful malaria vaccine has eluded us for many years, but it would appear that we finally have an immunization that is effective. What's your view on the latest results that we're seeing with regards to this malaria vaccine?
I think it's great to be back. I think on your question, it's the first step on following the three pilots we had in Ghana, Malawi, and Kenya. The three countries did a pilot, and now we've got the first vaccine being rolled out to the children. Look, the rates are not that fantastic. It's 30% effective or something around that level. But you know, some effectiveness is better than nothing. GSK has put a lot of R&D into making sure the vaccines move on. I would say this is the first step in Africa to try and reduce deaths occurring through malaria, and it's only going to get better from here.
And it seems like, at least with the case of this malaria vaccine, we're seeing greater cooperation coming from the pharmaceutical companies who manufacture these shots. We know vaccine equity in the past has been a big problem for the African continent. Are we seeing perhaps these pharmaceutical companies gaining more of an impetus or perhaps more of a conscience in terms of making these immunizations more available in Africa?
That's a brilliant question. And you, I, and the rest of the world would like to say we hope so. I feel that the pandemic brought in a value of collaboration that we have never seen before. The many pharmaceutical companies are beginning to see the picture of collaboration is the new innovation. And this is what I believe will be the beginning of impacting health or changing health systems across the world. Wait and watch, and let's hope we don't have inequity and divisions. We should leave no one behind.
That's right. And while we're seeing some significant and positive signs in terms of combating malaria on the African continent, elsewhere we still have outbreaks of other diseases such as cholera in the south of Africa. We're still a long way away, aren't we, from preventing some of these deadly diseases on the continent?
You're absolutely right. You know, people say we should be less scared of missiles, but more about the microbes. And so these microbes are taking lives, and it's affecting many, many people on the African continent globally. So the disease surveillance system has to be stronger. The prevention has to take a center stage in the national health priorities, and we should have a stronger shield to prepare us and from preventing epidemics being spread. From outbreaks, we prevent them becoming epidemics and then prevent the epidemics becoming pandemics. So I think in the next 20, 30 years, we should have a foolproof system, a much foolproof system in most of parts of the world around managing outbreaks, epidemics, and pandemics.
Okay, Amit Thakker, we'll leave it there for now. Thanks as always for joining us on the program.